Hi there, Duncan here, physiotherapist and owner of Life is Movement, here with another exercise video demonstration. I make these videos for my patients here at my clinic. However, if you're not a patient and you find any of this valuable, you're of course welcome to take it and run with it as you see fit. Just please make sure you do so safely. So I just wanted to show one exercise today, or one exercise in a variant, for people who have problems in and around the elbow or the wrist. I give this exercise for people who might be suffering from medial or lateral epicondylitis, tennis and golfer's elbow. Sometimes for people who have some sort of nerve irritation from either the shoulder, the upper back, or from a disc in the neck. Give this exercise for a variety of reasons. But basically, the research is very clear that an entry point into building this whole kind of area back up is through isometric style exercises. So if I'm doing a bicep curl, I have the concentric phase of the exercise, so the lifting phase, the eccentric phase of the exercise, the lowering phase, and of course isometric, which is where I sort of resist against some sort of force, but I'm not actually going anywhere. You could see, maybe if my bicep were a bit bigger, you could see I am sort of flexing the muscle, it's working, but I'm not going anywhere. So these are isometric exercises that work the elbow joint, and depending on where you provide the resistance, the wrist as well. So to work the sort of bicep area, the elbow flexion, all you have to do is exactly as I just showed. So you provide some sort of resistance, either sort of at the forearm or on the hand if you also want to work the wrist flexors, and you just provide some resistance with the other hand and hold that contraction. And the protocol I like to use is 5 repetitions of 5-second holds. So we're going to do 5, 4, 3, 2, 1, and then rest, shake it off. And then we're going to repeat that 5 times. So 2, 3, 4, and final one, 5, 4, 3, 2, 1. So that's one option. The other option is to do it in the sort of inverse. So you're going to turn the wrist. We do the exact same thing, a sort of elbow flexion, but just turning the wrist so the palm is facing down works a slightly different set of muscles and nerves. So we're going to do the exact same thing, provide that force, but this time on top of the wrist. And we're going to do 5, 4, 3, 2, 1, that isometric contraction for that same protocol. 5 repetitions of 5-second holds. Isometrics can be really valuable entry point into rehab. They can be really good for pain relief. They can be really good to sort of wake up and really start to reuse injured parts of the body. So we use that protocol normally in the early stages of rehab. Give it a go. I hope it helps for you.